Welcome back to Today's Health. In this segment, we're going to talk about end-of-life care in the home, including hospice services, with McLaren Hospice Director Cindy Tomlinson. Cindy, thank you for joining us today.
Thank you. Thank you for having me.
Now, for those individuals who have a life-limiting illness and recovery is not an option, what are the options available for treatment?
There's a couple options available. One of them is palliative care. Palliative care are for those people who want to continue, they have a life-limiting illness, but they want to continue treatment. So maybe they're continuing chemotherapy or radiation, and they're not quite ready for hospice services at that time. So we offer palliative care, which provides supportive care to the patient and their family and helping guide them through their illness and the process. If they've gone past that, and they've decided they don't want any further treatment, then we offer hospice services. And hospice is for people with life-limiting illnesses where treatments are not an option for them to prolong their life.
Now, we have heard before that it's very difficult to have that conversation, the initial conversation about hospice care. How and when, ideally, should this conversation take place?
It's probably one of the most difficult conversations our healthcare workers need to have with our patients. Ideally, the first conversation would occur when a patient finds out, or when a physician determines that a patient's illness is terminal or life-limiting. That's the best time to start it. It doesn't mean the patient's going to select hospice care at that time, but if we can start the conversation, then we have a much better chance of them wanting to accept hospice services and the support that we can provide to them.
Now, can you tell us where McLaren Hospice Care is available?
McLaren Hospice is available in 36 counties in Michigan. Pretty much if you go down the middle of the state, east, we cover almost the entire half of the state. We have major branches in Davison, Lansing, Sterling Heights, and Bay City. We also cover the Port Huron and St. Clair County area.
Can you tell us a little bit more about the hospice care team? Who is included in that?
Our team consists of a physician. We have a medical director on staff, but our patients oftentimes choose their own family practice doctor to follow them. We have nurses, we have social workers, we have counselors. Probably one of the most valued assets for our patients are our hospice aides. We have volunteers and bereavement services.
Now, is hospice care covered by most insurances?
Yes, Medicare and Medicaid have a full hospice benefit. That covers everything for the patient related to their hospice diagnosis. So things like their care team coming out to visit, their medications being delivered to their home, equipment coming to their home, that's all covered under that benefit. Other private insurances, almost all of them have a hospice benefit as well.
Now, I imagine that there are some patients and families who are really struggling with a terminal illness or diagnosis. How do you help those folks through these times?
That's where our hospice team expertise comes in. Our social workers are very skilled at having goals of care conversations with our patients and their families. Oftentimes they'll have a family care conference, we call it, so that everybody in the family has a chance to express their concerns or their feelings, and then we work together with that family as a unit to help meet their goals of care, help move them through the process.
Now, you mentioned earlier that you have a lot of hospice volunteers. What do the volunteers do?
We have a really robust hospice volunteer program. They do everything from sitting at the bedside, reading, providing companionship, helping with some light housekeeping. In the fall, we have volunteers that will go out and do fall cleanup in the yards or in the spring. We also have volunteers that work our fundraising activities and work in the office. Some people want to give, but they're not comfortable going to a bedside, so they provide office duties for us.
Cindy, where do you provide hospice services at?
Basically, hospice is provided wherever the patient resides. So majority of our patients want to stay in their home until the end of their life, and so we provide services in their home. Some live in long-term care facilities or assisted livings. We'll provide care there, and for short-term stays we can provide care in a hospital setting if there's a symptom that needs to be managed. We could assist the patient there in the hospital and then help them with their discharge home.
Now, what feedback do you receive from family members who have been through the hospice process?
Our patients' family members are very satisfied. Most often they talk about how comforting it was to know that they had somebody that they could call 24 hours a day, 7 days a week. They don't have to run out to an emergency room in the middle of the night because our staff, our nurses, are available 24 hours a day, 7 days a week. They go out in the middle of the night for all kinds of issues that the patients might have, and it's very comforting for families to know that all they have to do is pick up the phone and call.
So for anybody out there watching who's interested in becoming a hospice volunteer, how do they go about that?
We would love to have them, and we would encourage them to either visit us at our website or call our toll-free number.
Cindy, this has been great information. Thank you for joining us today.
Thank you.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.